When your baby's born, we check that it's well, both in the hospital and in the community settings. There's lots of things we look out for, however, it's really important that you are aware of the signs and symptoms of an unwell baby. A well, healthy baby should have regular, quiet breathing patterns. Grunting, snoring can all be signs of an unwell baby. If your baby has a white skin tone and becomes blue, or if your baby has a darker skin tone and becomes paler, this can often be a sign that they are unwell. If this happens, it's really important that you seek professional advice. Signs of infection in a baby. So if your baby becomes floppy and unresponsive, irritable, doesn't wake for their feeds, or becomes hot or cold to touch, it's really important once again that you seek medical advice. A good nappy output is also a really good sign of a healthy baby. So initially, the first poo is that nice black tar, and we like that to change within the first few days of life, going from a black tar to a green pesto to a yellow coma by day 5. This is always a good sign of feeding and a well baby. We also look for wet nappies. So on the first and second day, we're looking for 1 to 2 wet, heavy nappies. By day 3-4, we're looking to 3-4, and so on. So what is normal with regards to vomit after birth? So if you've had a really quick vaginal delivery or cesarean section birth, we do expect babies to be quite mucousy within the first day or 2. We expect a mucousy vomit. That can be completely normal. However, after that, babies should only vomit up small amounts of milk. If they are projectile vomiting all of their feeds, or if it's a colour such as yellow, black, brown, any other colour other than a milk colour, you need to seek advice. So you'll all have heard of jaundice, and this is something we check for post-birth. Jaundice is the yellowing of the skin and the eyes in newborn babies and can be a completely normal process that they go through post-birth. However, some babies are more affected than others, and if you think your baby's jaundice is worsening, it's really important that you contact either Ward 16 or your community midwife for that baby to be checked. The umbilical cord is something that we check also postnatally. Cords can be a little bit smelly. They are dead tissue, and that can be completely normal. However, what we're looking for is redness, heat or swelling around the cord. If you think your baby's cord is becoming infected and is showing these signs, please contact a professional. Babies can pick up things like colds shortly after birth, and they can be perfectly fine and recover fine from them. However, if you are ever concerned about your baby's health, no matter how big or how small, we are always there to help. You can either contact your GP, your community midwife, whose number should be in your badger notes, or Ward 16, where there is a midwife there 24 hours a day, 7 days a week to give you help and advice.